Namaste Betiya, Hamisha Khush Raho Betiya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about another important case from the OPD, a case of pain abdomen. As you have been doing in the past, in today's lecture as well, we are going to discuss about the complaints of the patient. We are going to understand the chief complaints. We are going to understand the investigations. And then, as we have been doing in the previous lecture, that you have to analyze and evaluate the case, and then you have to do the repertorization. You have to repertorize the case, and then you have to reach at a particular medicine. So let's start with the case of pain abdomen. A 35-year-old male patient. A 35-year-old male patient came to the OPD with the complaints of persistent pain abdomen for several years. The pain was of dull, aching character, and he complained of a lot of gas and irregular bowel habits. The pain started following some financial stress and illness with his wife. So, in this case, a 35-year-old male patient came to the OPD with the complaints of persistent pain abdomen for years. Here, the patient is having pain since last so many years, and the character of pain is dull and aching type, and he complained of a lot of gas and irregular bowel habits. How does the pain start? This is a very important thing. The pain started following some financial stresses and illness of his wife. The pain persisted in spite of detailed investigations and treatment. He had not lost any kind of weight, but the pain is still present. There is no disturbance of any kind in his appetite. The appetite is good, and the patient has not lost any kind of weight, but the investigations are also normal, and still the pain is persistent for years. He complained that he had difficulty in falling asleep and at night, and sometimes he woke up early in the morning. He had lost interest in the social activities and avoided religious functions in his family. Due to the pain, he had lost interest in all kind of social activities, and he has avoided religious functions in his family. The clinical presentations includes the duration of pain is of long duration, and there is irregular bowel movements that is associated with flatulence and bloating sensation that is often diffused or localized to lower abdomen. So the symptoms are of long-standing, years of long-standing pain is there, and the irregular bowel movements is associated with flatulence and bloating sensation, often diffuse or localized to the lower abdomen. The pain may be relieved by passage of flatus or defecation, but the pain is again relieved. So the pain is of a long duration since years, and there is irregular bowel movements that is associated with flatulence and bloating sensation, and it is of diffuse and localized in the lower abdomen. Pain may be relieved by passage of flatus or defecation. There is no any history of weight loss or weight gain. The weight is constant, the appetite is good. There is no disturbance in the appetite of the patient, and the abdominal examinations are almost normal. There is no any kind of problem that is found in the examination of abdomen. Now, what is the provisional diagnosis? Provisional diagnosis consists of abdominal neurosis. Because there we cannot find any kind of pathology involved due to the pain abdomen, so we called it as neurosis. And therefore, the condition is known as abdominal neurosis. The differential diagnosis, the various conditions which resembles the condition of the patient, which we have to differentiate one by one, includes the peptic disease. Peptic ulcers are also having the similar clinical features as mentioned by the patient here, but we have to differentiate by other investigations. Reflex esophagitis, that is known as GERD, gastroesophageal reflux disease. This also comes with the same complaints that of the patient, but again we have to differentiate all these complaints. Amoebic colitis. Amoebic colitis also presents with similar clinical features, but need further investigations. And the last one is the most important, irritable bowel syndrome. So irritable bowel syndrome also have a similar kind of manifestation. So differential diagnosis consists of peptic ulcer disease, GERD, gastroesophageal reflux disorder, amoebic colitis, and irritable bowel syndrome. These things have to be differentiated by detailed case study and further investigations. Now, what were the investigation that were done in this particular case? Investigation then are required includes the routine investigation of blood, that is CBC-PSA, most commonly done investigation. The stool examination, routine stool examination for presence of any kind of cyst, vulva, or any kind of infection that need to be done. So you need to perform blood investigation and the stool examination. Various kind of special investigation are required, like ultrasonography, ultrasound, USG, whole abdomen, to rule out any other cause of pain abdomen. Endoscopic examination, if nothing could be found in the USG, then endoscopic examination is needed, especially to rule out the peptic ulcer disease. So this was the routine examination and the specific examination that is needed to be done in this particular patient. So this was the whole case that came in the OPD. Still, a lot of things were missing, but in the first case taking, we could find all these details. Since the patient was in great agony and he was not willing to tell the more details about the case, so medicine was prescribed. But now it's up to you to complete the particular case. You have to analyze the particular case, you have to evaluate it, and then reach at the particular repertorial totality. After repertorization, you have to come to a final diagnosis, final medicine conclusion. And then we will be prescribing that constitutional medicine and we will see the result. So this was all about the case of pain abdomen, which came into the OPD. Now it's up to you to complete the particular case and reach out a single medicine. I also recommend you to differentiate between top 5 medicines so that you can learn more about those 5 medicines which are coming in the top 5 list. So this was all about the case today, the case of pain abdomen. We will be meeting in the next case, with a new case in the next lecture. So this was all for today. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.